Good afternoon. I'm Mike Barnhart, Volunteer State President for AARP. It's my pleasure to introduce today's speaker, Executive Vice President of the State and National Group for AARP, Nancy LeaMond. Ms. LeaMond is responsible for driving AARP's social mission. She leads AARP's government affairs, legislative campaigns, public education, community engagement, and volunteerism and service. She manages a team of 650 staff and more than 17,000 volunteers, myself being one, and there are a number of others here in the room, across all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. During her tenure at AARP, she has led several landmark campaigns, including You've Earned a Say, an initiative that engaged more than 10 million Americans in the debate over Social Security, Medicare, and multi-state utility campaigns that have saved consumers more than $1.8 billion by fighting home energy increases. Before coming to AARP, Ms. LeaMond served as the Chief of Staff and Assistant U.S. Trade Representative for Congressional Affairs at the Office of the United States Trade Commission, or Prior to that, she worked extensively on health care, pension issues, beginning her career in the Public Service, Health Service, the Medicaid program, and the Department of Commerce. Ms. LeaMond also has a professional connection in Ohio. She worked for Congressman Mary Rose Oker. She's a national thought leader, an expert on issues related to older Americans, and was named by The Hill publication as one of the top lobbyists in Washington for the past 3 years. She holds a bachelor's degree from Smith College and a master's degree in public policy and urban planning from the John F. Kennedy School of Government at Harvard University. Ladies and gentlemen, members and friends of the City Club of Cleveland, please join me in welcoming today's speaker, Nancy LeaMond.
Thank you, Mike. Mike mentioned that I oversee 17,000 volunteers, some of whom are here. That means that I oversee the largest T-shirt budget in the United States of America. And thank you also to Dan. I told him earlier that a little more than 30 years ago, I attended my first program at the City Club of Cleveland, and I'm honored to be here today to speak at one of the most highly respected forums for discourse in this country. You have hosted public officials, reformers, innovators, even former presidents, and singularly impressive to me as an ardent baseball fan, Babe Ruth has even stood at your podium. Now, I'm sure these days you're being approached by many people from Washington, D.C., but unlike most of them, I can assure you that I'm not here to ask for your vote in 2016. Rather, I'm here to talk about aging in America, the aging in Ohio, and the aging of Cleveland. Now, as Mike mentioned, I served as a chief of staff in the Ohio congressional delegation in the 1980s, and I was actually in that role when the decision was made to bring the Rock and Roll Hall of Fame here. Now, while I've noticed some changes since I was here last, I'm glad to say that from everything I've seen, Cleveland is still the city that rocks. And in addition, congratulations to all of you on the Cleveland Browns. An infinitely superior football team this year to the DC football team. And you know, I'm not at all surprised since I managed to see draft day a few weeks ago. Now, some of you know AARP as the group that sends you mail when you reach the age of 50. Have any of you ever heard from us? Well, yes, we do celebrate the aging rite of passion, as does the New Yorker. This woman says to her husband, "I'm going to need a hug, Maurice. It's from the AARP." But what you may not know is that we're the largest membership organization in this country. We have 38 million members, including 1.5 million here in Ohio, and 550,000 in Northeast Ohio. We have a basic, fundamental social mission, strengthening communities and fighting for issues that matter most to the older Americans and their families. And we have a team of staff and volunteers in Ohio, led by Mike as our volunteer state president and our state director, seated up here, Jane Taylor. They are working on behalf of older Ohioans every single day, fighting utility rate hikes, saving you money on playhouse tickets, educating people about financial and health security, family, caregiving, and more. Now, not surprisingly, given that our members share the distinction of being 50 plus, AARP spends a lot of time and energy on aging issues. And there's a lot to talk about, because simply put, the U.S. is getting older. On January 1st, 1946, the first of 78 million baby boomers was born, representing the most significant demographic shift in our nation's history. And this year, the last of the boomers, including Johnny Depp, Michelle Obama, and Sandra Bullock, turned 50. Now, by 2030, 1 out of every 4 Americans will be over the age of 50, and the 65-plus population will nearly double to 72 million. Now, on the screen, though it may be hard to see, you'll notice that the darker the blue, the older the places are. So just see this progression. And the elderly themselves are getting older. In 2030, there will be 19 million people over the age of 80. Now, just as we're aging in the aggregate, every state is aging. There are simply no Benjamin Button states. No place is getting any younger. And even the so-called younger states like Utah and Alaska will see an increase in their older population by more than 30% over the next 20 years. And Ohio is no exception. In Northeast Ohio, there are already 1.5 million people age 50 plus, with 630,000 over the age of 65. Cleveland's population is one of the fastest aging in the country. Your median age has risen from 37 to 41 since 2000. And this trend towards older is not one generation and done. Yes, there are a lot of boomers, but there are even more millennials, 82 million of them. There will even be a day, January 1st, 2042, when the boomers and the millennials will receive Social Security's checks at the same time. Now, in a nutshell, our country, our states, and our towns will be older in perpetuity. Now, as America grows older, it's going to be a different kind of older, different than previous generations. For one thing, the face of aging literally looks different. According to the census, the 65-plus population will become 40% minority in 2050. Physically, we are healthier, though we take more prescription drugs and have more hip and knee replacements than our parents. But we even have a new mindset from them about aging. It's called denial. This feeling is captured in yet another cartoon of a sweet young thing and an older gentleman who says, "Of course you're not old anymore. Nobody's old anymore." And as the author Nora Ephron said, there's a reason why 40, 50, and 60 don't look the way they used to. And it's not because of feminism or better living through exercise. It's because of hair dye. That's a point I can uniquely make. Now, today, most people who make it to 65 will roughly live 20 years beyond traditional retirement age, meaning that we have a new life stage that didn't really exist before. At AARP, we call this the age of possibilities and life reimagined. This is the era of the individual when everyone gets to be CEO of my own life. When we were younger, most of us assumed we'd work until 65 and then enjoy some time in the sun. But now there are forks in the road to keep working, phase into retirement, or maybe even start a new career, to move to Florida, stay put, or move to Florida and come back because we didn't care for the Miami heat. To figure out how to make retirement savings last, or for a lucky few, to decide how to spend down all of our assets. Which brings me to my next point. The collective economic impact of boomers surpasses any generation before them. There's a widely held and unfortunate belief that older Americans are only a drain on society. But this view doesn't recognize the economic contribution of people 50 plus. As a group, the over 50 crowd controls nearly 80% of US net worth. And research by Oxford Economics shows that Ohioans over the age of 50 contribute to the economy in an outsized proportion to their share of the population. In 2013, people 50 plus accounted for 43% of Ohio's gross domestic product, representing $245 billion, and they supported 3.5 million jobs in the states. While the collective snapshot is one of wealth, the picture of individuals and families obviously varies. In Ohio, 45% of your workers lack access to a workplace retirement plan. And according to the National Institute for Retirement Security, Ohioans have only saved on average $27,000 in their defined contribution plans, which is why when people reach their 60s, they rely heavily on Social Security. 61% of Social Security recipients in the state depend on the program for more than half of their income. And in Cleveland, roughly 20% of seniors live in or close to poverty. So to recap quickly, our country's getting older and will be older from here on out. Aging looks and feels different. The boomers are bringing billions in spending power into their later years, but the financial outlook for many is quite uncertain. And that's why we call this the Great Age Wave, because these societal changes will have profound implications for our country, not just for individuals, but for all of our institutions. Just look at the institution of government, which has been deeply involved in aging ever since Social Security was created in 1935. The sheer number of boomers heading into their 60s, 70s, and 80s will present challenges to Social Security, Medicare, and Medicaid, programs that are central to the health and retirement security of millions of older Americans. And the growth in the oldest among us will place unprecedented demands on healthcare and aging-related services. We need innovation. We need responsible solutions that address the challenges before us. Now, unfortunately, some of the policy conversations about aging tend to focus too much on spreadsheets and numbers. And these conversations ignore the economic struggles of too many Americans. And they suggest often that generations are out to rob other generations. Instead of helping us together to solve our country's problem, this narrative pushes us further apart. AARP has been calling for a different conversation, one that reflects the complexities and nuances of how generations work together, live together, and support one another. We want to be sure that important federal programs like Social Security and Medicare are here for today's, but also for tomorrow's generations of older Americans. And as we move to this conversation, we need to have, in the near future, there are two elephants in the room, which is appropriate for Cleveland, given your 2016 Republican convention. The first is the retirement challenge, which I alluded to earlier. Today, 57 million people do not have access to retirement savings plans in the workplace. The Employee Benefit Research Institute found that almost half of baby boomers and Gen Xers will lack the income to meet basic retirement expenses and healthcare costs. You know, there's a new word for retirement. It's called work. And I think this cartoon sums it up well. Man and wife talking to one another when one says, "We'll just squeak by if we take a late retirement and an early death." And the second is the caring challenge. 7 out of 10 people who make it to 65 will need care in their later years. Given the demographic shifts in the coming decades, there will be more people who need care, but there will be fewer family caregivers to give them the care they need. These are two seminal and interrelated issues that will present the two biggest challenges to all sectors of society. Certainly our federal government has a role to play, but in this era of gridlock, we look increasingly to state and local governments to fill the void. Resources are limited and budgets are very tight, and we know we cannot finance all of the emerging challenges we have with cell towers, marijuana taxes, and speed cameras alone. Contrary to the idea that every policy solution must be big and expensive, there are cost-effective ways to tackle some of these biggest challenges. Look at long-term care. Too frequently, we move people into nursing homes rather than helping them live independently as they age. We need to shift our resources, energy, to help people stay in their homes, which is where they want to be. It's good for people, but it's also good for the bottom line, because home care is on average 1/3 the cost of institutional care. In Ohio, you've made a lot of progress on this in recent years. In 2012, only 40% of your Medicaid dollars went to home care, and today roughly half of all dollars are used to help people age in place, and it's expected to grow to 60% by June of 2015. And just as we need solutions for people to age in place, we also need solutions for the 42 million people in the country who provide care for a loved one. I'm going to do a quick test in this room. How many of you are now caregivers or expect to be a caregiver in the not too distant future? Okay. I don't want to call you average, but about 7 out of 10 people raise their hands, and this is roughly where we are in the country right now. Now, AARP has developed model legislation that helps family caregivers get information and training before the person they care for is discharged from one setting to another. This costs the government nothing and saves money on costly hospital readmissions. While we've seen a mixed response from government, we've seen more innovation, frankly, out of the business community. Historically, marketers have targeted the younger in lieu of the older, but savvy businesses, investors, and marketers are beginning to give older consumers the attention they deserve. For example, Walgreens health clinics are moving from treating scrapes and bruises and strep infections to offering wellness initiatives and diabetes management. Silver Ride in Seattle takes a page out of the Uber playbook, providing transportation and courier services for older adults. Trader Joe's sells smaller portion meals, which appeal to thrifty recent college grads as much as empty nesters with fewer mouths to feed. And L'Oreal retains 56-year-old Andy McDowell as the face of skincare and beauty. Now, of course, business will have to adapt in more ways than one, not just to their markets, but also to the changing nature of their workforce and their role as an employer. Just as the inclusion of women changed the workplace of the 20th century, the aging population will change the workplace in the 21st century. Although some will retire with decent pensions, 50% of non-retired boomers today say they have little confidence they will ever be able to retire. Boomers make up 1/3 of the U.S. workforce, and employers need to develop new policies and practices to meet the changing wants and needs of older workers, a highly educated, capable, and sizable segment of the workforce. Some employers are ahead of the curve because they recognize the value of an age-diverse workforce. For example, TriHealth in Cincinnati uses senior placement agencies to target mature workers and retirees, and they created a central resource to help their employees find services for the older adults they care for. For the first time in modern history, the workplace spans 4 generations, with 20-year-olds working side by side 70-year-olds. And there's one thing we all have in common: the desire for more flexibility. Millennials inherently want to mold their workday. Gen Xers and boomers simultaneously care for kids and parents, while the oldest of workers may want to just phase into retirement. And despite a pervasive view about older workers taking jobs away from the younger set, the truth is there's been room for everyone. The Center for Retirement Research at Boston College did an extensive study. They found that keeping older people in jobs does not take away opportunities from the next generation. And finally, I want to mention one more institution that spans public and private, for-profit and nonprofit, and that's the built environment. Just as people are aging in place, so too are communities. In 1985, Betty White moved in with the Golden Girls in a shared ranch in Miami, older people coming together to live in a place more economical and more efficient. 25 years later, the ladies moved in with Betty in her Cleveland Victorian. Now, while some still opt for palm fronds and putt-putt, today's 50-plus are by and large staying put. In fact, 83% of boomers plan to stay in the very same house they're in when they retire, meaning cities and communities must respond to the wants and needs of a constituency that is growing older and is planning to stay home. Now, unfortunately, based on research AARP conducted with Governing Magazine, we know that most communities are largely unprepared. People lack access to and proximity to services they want and need as they get older. Their homes are not always conducive to aging in place, and they don't have transportation options to get around their community. That said, we're witnessing right now a sporadic but growing effort by local leaders across the country to make their communities more friendly to people of all ages. And there's progress right here in Cleveland. Uber's recent expansion in the Cleveland market will provide locals with more options to get around. The Cleveland area has 3 major organizations: the Cleveland Department of Aging, the Cuyahoga County Division of Senior and Adult Services, and the Western Reserve Area Agency on Aging, that provide innovative services and supports to assist your older, growing population with their basic needs. And according to walkscore.com, Cleveland is the 16th most walkable city in America. And in fact, people refer to your downtown, I don't know if you know this, as Walker's Paradise. Now, as a sign of your success, the Downtown Cleveland Alliance has seen a 70% increase in people aged 55 to 64 moving downtown. So these are just 4 sectors, but we know that every part of our country and our economy will be affected by and play a role in the aging of America. From design to healthcare to education, no corner of society will go untouched. And at the same time that we look to major institutions, we can't lose sight of the fact that the most interesting and innovative things are happening from the ground up. When people don't have access to societal or structural supports, they will create them. Eastside Connections in nearby Beechwood is a naturally occurring retirement community where people over the age of 60 connect with neighbors to build a network support. Cleveland's intergenerational school brings in older individuals from the community to mentor students. And at the same time, the school sends students into the community to interact with seniors, many of whom have been diagnosed with Alzheimer's disease or dementia, through art, song, literature, and storytelling. Just last month, I read about this man, Ralph Bolin, a resident of DC. He was on the verge of being forced into a nursing home, but his neighbors raised $21,000 through crowdfunding to make repairs to his apartment so he wouldn't have to move. Which goes to show, just as states and communities are laboratories for innovation, so too are citizens who band together to bring about change. This is the generosity, the ingenuity, and the wisdom of crowds at work. In closing, I just want to reiterate what many of you already know. We are at the epicenter of a demographic transformation, a special moment in time. Every part of our country and economy has a role to play in the aging of America. And yes, there are significant challenges, but there are also tremendous opportunity. Now, I'm a Washington Nationals baseball fan, and I know that Cleveland Indian fans can relate. I'm an eternal optimist. When I look around the city, I see signs of renaissance that people talk about. As you redevelop, redesign, and renew, this is the perfect time to secure your position and to lead as a place for people of all ages. And I have no doubt that Cleveland has the vision and the gumption to go big and to go bold. I mean, I've seen that chandelier. Thank you all very much for your time, and I'm happy to answer questions.
I'm just going to make the transition here. Hi, everybody. Hello again. I'm Dan Moulthrop, Chief Executive here at the City Club, and today we're enjoying a wonderful forum featuring Nancy LeaMond, Executive Vice President of the State and National Group at the AARP. We welcome all of you here and those joining us via our live webcast, which is sponsored by the University of Akron. You should be sure to tune in to our Friday forums and other programs that are carried by our primary media partner, 90.3 WCPN, WVIZ PBS 104.9 WCLV Idea Stream, or one of the many other radio stations across the region and country that carry City Club programs. Television broadcasts of the City Club are made possible by Cleveland State University and PNC. This Friday, speaking of demographic changes, this Friday, November 14th, the City Club welcomes Richie Paparinen from Cleveland State University's Maxine Goodman Levin College of Urban Affairs and the Center for Population Dynamics. For more information about that program or any of our upcoming and past forums, please visit us online at cityclub.org. Our community partners for our program today are the Benjamin Rose Institute on Aging and Judson Services and, of course, the AARP. We thank you all for your partnership and your support. We welcome guests at tables hosted by AARP, Benjamin Rose Institute on Aging, Direction Home Akron, Canton Agency on Aging, Greater Cleveland Food Bank, Judson Services, and the Western Reserve Area Agency on Aging. We thank you all for joining us today and for your support. And now it's time for our traditional City Club question and answer period. We welcome questions from everyone, including guests. We ask only that they be in fact questions and not statements or speeches. Holding our microphones today are our administrative assistant, Jackie Powali, and our content associate, Teddy Eisenberg. Do we have our first question, please?
Thank you for being here. And my question is, can you talk a little bit about the impact our most recent election has on policies for those of us 50 and older, and do you see any possible areas of compromise?
Well, thank you for the question, and obviously this is something that we are looking at very, very closely. One area we very much hope there will be action on early in the Congress and maybe even during the lame duck session that starts tomorrow is the Older Americans Act. This is a piece of legislation, provides funding to a lot of services around the country for older Americans, including Meals on Wheels. And we have bipartisan support for that legislation. There are a few things that need to be worked out. We're very hopeful that we can move that through the Congress very quickly. As we move into next year, we're going to have a debate sometime before the end of March on what is lovingly called the doc fix. And for those of you who are not aficionados of the Medicare program, it turns out there's a provision that if Congress doesn't act, doctors' reimbursement for services are automatically reduced. And as you can imagine, this creates a lot of uncertainty and problems in the system. So before the end of the first quarter of next year, we're going to have to work to see if we can make the changes necessary permanently so we're not revisiting that every year. I'm very pleased to say that although we never could find in the last Congress bipartisan support of how you might pay for that change, there was support for a change of policy that, if you think of it, is going to be tremendously important, and that is to reimburse medical professionals for the care they provide and not just test by test. So they came together on what is a very challenging issue of policy. Now we have to come together on how you fund it.
Ms. LeaMond, you mentioned in your remarks Social Security and how it provides a lot of support to many of the retired people. Mm-hmm. And there's a lot of discussion, of course, of how do you fix it long-term or fund it long-term, right, and Medicare long-term. Mm-hmm. Too often, I think the media has painted retired people or people that are on Social Security as totally against any change. Mm-hmm. And I think AARP gets in that bucket in the public perception, mm-hmm, you know, that because AARP is older people, they're against, yeah, change too. So can you outline better and in more detail what AARP's position is and what kind of discussion you think we need to have and what some of the potential solutions are, sure, to the long-term problem?
Thank you. And as you point out, Social Security is a lifeblood issue for older Americans, and not just over older Americans, but obviously very important. There's been discussion over the last 3 or 4 years as part of the budget and the deficit debate about Social Security. And our position has been that's not the right arena in which to have the conversation or to try to solve the problem. We need to engage, and to do that, we're going to need, back to your question, we're going to need leaders of both parties and the President of the United States to come sit around the table and put everything on the table and look at all of the different ways we can change the program so that it can adapt for the world in which we live today. Remember, it was built in 1935 and hasn't changed dramatically since then. So our basic desire is, and we'd be very supportive of an effort to bring bipartisan leadership around the table with the President of the United States, just as Ronald Reagan and Tip O'Neill did in 1983, and look at a range of issues. As we've talked to our members and others across the country, including in Ohio, where Mike mentioned our You've Earned a Say effort, which has been designed to talk to people, talk about the various options for reform, we find that people are very open to change. But the change has to be a change that ensures that people who are on Social Security can retain their standard of living, but also build it so that it can meet the needs of many generations. Too often we talk about just Social Security solvency, and that means making sure the program doesn't run out of money. We also need a conversation about adequacy. It needs to be adequate for the people who have paid into the system and are going to need it to live on. But there is no question that this is one of the most important issues on the AARP agenda. Social Security is completely secure until 2043. And even beyond that, if we did nothing between now and then, it could pay 75% of the benefits. So I don't know about you, but I don't know very many issues that don't become a crisis until 2043 that we've been embracing as a country. We need to move quickly on this, though, because the sooner we do, the more we'll be able to put in place changes that can be adapted over time.
A few years back, by the way, thank you for the DVD and program you put out about the aging Americans. Mm-hmm. I shared that with many different organizations in Medina County, whom I happen to represent. But in very recent meeting, I got it all down in shorthand here. If I could transcribe it, it'd be all right. In a recent meeting, Ron Hill spoke of the poverty level increasing among seniors. And he happened to say that Medina County went up to, I believe, 5th in the state of Ohio, and with an increase of 35% of the poverty level in our area, our county. And the city of Cleveland or Cuyahoga County only had a 0.33%. Well, those are just figures, and maybe we never had any, and we only have 5 now. I don't know. But nowhere at all the meetings I've attended recently has anyone really, you've alluded to it in every one of your topics, but no one has really started to address that problem that more and more seniors are not able to live on just the income that has been provided.
Yeah. Well, as you point out, there has been increase in some places with the poverty rate of older Americans. One reason why it's so important for us to get the Older Americans Act through the Congress and funded is that many of those programs are serving the most disadvantaged seniors across the country. And it is an area where we're going to be spending more time and attention. And you're right, it might be going up in one place and down a little bit in another, but there's no question that this is a compelling issue, and one of the reasons we also need to continue to engage on Social Security. 50% of people roughly in this country rely on Social Security as their only or their major source of income in their later years. So there is really probably no program more important. Thank you for your comment.
Nancy. So much for joining us at the
Sure.
City Club today. I have a question about public transportation and the AARP's, whether or not the AARP does a lot of lobbying at the state level regarding public transportation. It's a big issue for the city of Cleveland because, as you probably know, the state of Ohio doesn't have, if you do a ranking for public dollars for public transportation in terms of per capita spending, we're pretty low when it comes down to it, especially when you think of the urban areas that we have and that our local transportation authorities are trying to serve. Does the AARP work in that field, especially given that many older Americans are realizing that their life can be much richer by giving up their cars? And what could we expect in the state of Ohio in terms of the AARP's support or interest in that issue?
Yeah. As you point out, transportation and mobility issues are top of mind in most forums we're now doing with our members. This has increased dramatically in the last couple of years, to be honest. I remember 5-6 years ago, there wasn't really as much conversation about it, but across the country, we have worked in public transportation issues, and increasingly we'll need to. I'll defer to our state director here later to talk about specific plans in Ohio and in Cleveland, but we recognize that this is an issue we need to engage in much more. I would say, in addition to public transportation, we're seeing, back to my comments about local initiative, we're seeing a lot of areas where citizens are coming together and working out at least partial solutions. So in some communities, groups came together and looked at school buses that were ferrying children in the early morning and the late afternoon, but essentially not on the road in the interim periods. And some of them are using them for services for seniors, especially in areas where people have given up their car keys. In other situations, we've seen groups coming together. We joked earlier, it's like the babysitting co-op. I don't know how many of you participated, but I did, and I gave my 4 hours, and then you gave me your 3. Well, we're finding that in communities, people are putting together co-ops, and in return for my driving you to a doctor's appointment, you might help me with some yard work, et cetera. We're going to need to see more than those solutions cropping up, because I think public transportation is going to increasingly be an issue for us.
Thank you for coming to Cleveland. Earlier in your presentation, you talked about minority individuals being about 40% of the older adult population by the year 2050. We know that those individuals will probably be among our lowest income individuals, bringing with them additional problems. What is it that AARP is doing specifically to move forward your agenda for working with older minority groups, including increasing and enabling them to become a member of AARP and actually being in communities and supporting those communities with some kind of initiative?
Thank you. Well, it would be great if they became AARP members, but that isn't our immediate goal. Obviously, what you've outlined is extremely important. AARP started as a national organization, and about 15 years ago, we began to focus and become a state organization. We established offices in every state. And the next phase, and we've already started this, is to become much more embedded in communities. And we are doing that in a number of places in a very kind of comprehensive and systematic way. But we're trying in the major cities to become much more active in the community. And in doing so, work very closely with community groups who know and understand the culture and different groups in that area. It's a lot to do, but as you point out, the future is going to be in our reaching out in a much more systematic way to multicultural communities. We have some terrific partnerships, and we'd be pleased to talk to you more about any specific ideas you have, not only here in Ohio, but across the country.
You talked about the viability of Social Security. If we raised the cap on which Social Security taxes are paid, or got rid of that cap entirely, we'd never have to worry again about the viability of Social Security. What's the AARP position on that issue?
Well, as I mentioned earlier, our belief is that we should come together and look at a range of options. Raising the cap is one of them, but we should also look at others, including the cost of living adjustment, which, as you may know, was talked about separately during the budget discussion. We have in the past supported raising the cap somewhat on as part of Social Security, but we also think it's really important to look at a range of options as we go forward. Raising the cap, even if you did it, I think all the way, doesn't solve the entire solvency issue. It makes a big step, but that is one of the pieces we need to consider, and we will at the time when we're able to get the leadership of the country to address the issue.
Thank you for being here today in Cleveland.
Sure, thank you.
And you talked about home care and shifting of resources to the more economical way of helping people age in place. Mm-hmm. What is the AARP and the government doing specifically with the policy and programs to walk the talk?
Well, we've supported in Ohio and across the country efforts to have home and community-based services as part of Medicaid. And we've had some success here in Ohio, work closely with the governor, and we've had success in many other states. It turns out that I think everyone is stepping back and saying, look, people want to stay in their homes for as long as they can. What can we do to ensure that? And also, by the way, if we do that, it also is going to cut the amount of money that we need to put in the system. So in that respect, it's positive on both sides of the equation. At the same time, we also recognize that many people who are staying in their homes also need help. And this is where this great issue of the family caregiver is going to be so important, and we have to find ways, AARP, other organizations, to give family caregivers the tools and the information they need to advocate and help their loved ones. It's going to be a very challenging issue. It already is. You can see by the number of hands that went up in this room alone how many people are now family caregivers, and they're going to be even more down the road.
Hi, my name is Ann Hunter. I'm with the Career Transition Center here in Cuyahoga County. Mm-hmm. I think about 2 years ago, I heard about an innovative program that was started in Cincinnati, funded by the AARP Foundation and the Walmart Foundation. Oh. And I wondered if you had any information to share about the program for people who aren't aware of it, and also about outcomes for the program, and whether or not there might be a thought of expanding that elsewhere in Ohio.
Wow. Well, I will confess to you, I've not heard specifically about the program, although often when I'm somewhere and I hear about something we've done, it's not so positive. So I'm very, very grateful for that. But what we'll be happy to do is find out more about it and get back to you or others in terms of what has happened. It is. I can say from your brief description, we are looking for opportunities where we can partner with business, with other nonprofits who are knowledgeable and right there on the ground, especially, to your point earlier, multicultural communities, to deliver services. Once we find a model of something that works well or seems to be cost effective, we also are very committed to spreading the word throughout the country, not only to our AARP offices, but to others that work in the field of aging. But I'd be delighted to talk to you afterwards and get more information. Thank you.
Hi, Sue Alexander. As everyone in the room is grateful that you are here, thank you. As someone who has attempted to be a lobbyist for senior issues, we finally got 10 minutes with somebody's intern, and that was as far as we got. So, what do you offer? Obviously, there has to be a trade-off. So when you go to speak to someone in Washington, what is your leverage? What do you bring that lets you in the door?
I've met with many an intern, I will say, and sometimes they're the most knowledgeable and powerful people in the office. So we never want to underestimate that. But What we try to do, especially if we're meeting with representatives in Washington, is to bring the face and the story of their constituents to them. And sometimes I talk to the people that work for me in Washington, and I said, what's the first thing you say when you go in and you meet with a congressman or representative senator? And, you know, of course, they would say, well, my name and things like that. And I said, no. I said, the first thing you want to do is kind of sit down and say, Senator, Congressman, I just want to speak to you on behalf of the 1.5 million members we have in the state of Ohio. And it does focus the attention, I will tell you. And for good reason, because I think people have become so jaded of the gridlock in Washington, and I think focusing on what this really means to people back home is hugely important. I haven't met with a single member of Congress who is not interested in what his or her constituents think. So I think it's very important to kind of give yourself some validation of who you're speaking for. And we always try to give the facts and not try to skew it in one direction or another. Really speak the facts and then finally put the human face on it. And when we have a really important issue, you can be quite sure that Mike, other volunteers, Jane, other members of our staff are going to be going to Washington, D.C. to make sure that when people look, they see people from their community and not just someone like me from down the street. But don't underestimate those interns.
We have a question from social media. Last Friday, we had a panel discussion on the switch from volume to value-based healthcare, which is looking at cost and outcomes and choosing treatments.
Yeah.
As people get older and live longer, how is this switch going to affect this population?
Well, as I mentioned a few minutes ago on this kind of arcane issue of how you reimburse in the Medicare program, the so-called doc fix is exactly that. It's moving from reimbursing care based on you had this test, you had this x-ray, you did this, to more of an approach of you're being treated for diabetes or heart disease. And that's going to be hugely important. Second, we've already seen some of the advantages of the chronic care management efforts that are underway across the country. Medicare, when they recalculated how solvent Medicare is, a number of years have been added to that just by the early efforts to do coordinated care. This is the single most important thing, I believe, that's happening in the Medicare program, and it's essential that we continue to find ways to lower the cost of delivering care while at the same time providing the quality we need. And I should mention, it's obviously not just in Medicare. We're most familiar with it through the Medicare program, but with others. And I'm delighted you did a program, because one of the hardest things is to shine a light in the public policy arena on things that are working. And that's hugely important. And also, to your point about lobbying, it's really important to show what's working. People are kind of well aware of everything that's not working, but when you have approaches that are starting to cut costs, provide quality, it's incumbent on all of us to show that and tell that story. Great. Thank you. Thank you. Thank you. Thank you very much.
Thank you, Nancy. Today at the City Club, we have been enjoying a special forum with Nancy LeaMond, Executive Vice President of the State and National Group for AARP. Thank you again, Nancy, and thank you, ladies and gentlemen. This forum is adjourned.